and I'm going to hand it over to Dr. Ricciardelli. I'm just going to make you host here.
Yeah, and I'm just going to start sharing my screen. Okay, so I'm going to actually present on behalf of myself and Professor Noni McDonald, who is one of the founders of MicroResearch. And I'm going to give you a little bit of a summary of what MicroResearch has done, and then talk a little bit about how it's come to Newfoundland and how we're expanding it moving forward. So I've only been involved with MicroResearch for the last couple of years after meeting Noni, and she's a bit of a powerful force. So when she decides that someone's getting involved in doing stuff, it happens. Basically, MicroResearch, and I should introduce myself first. So I'm a professor and a research chair in safety, security, and wellness. I'm now at the Marine Institute at Memorial University, but I also do have a cross appointment in medicine to community health and humanities. So when we're going to talk about this in building MicroResearch, what MicroResearch is at the end of the day is we take persons interested in developing research skills or fine-tuning research skills. A lot of our participants are actually clinicians who would like to be more involved in research, but because of the demands of their clinical practice, maybe have a need to kind of like, learn some tricks of kind of getting it done a little bit more efficiently, quickly, and understand, where to find their research questions. So in the MicroResearch I've been involved in, we've done one in Halifax, which was all clinicians, and we've done it at the MI, which is people with an applied focus. And right now we're doing it in a grade 6 class, and in January we're doing it in Flat Bay in an Indigenous community. So it's pretty interesting and it's moving quickly. So they're the ones that I've been involved in directly. So one of the ideas behind MicroResearch is you inform and you teach the skills necessary, and you make research accessible. And research doesn't have to be difficult. We can talk about it in really difficult ways and make it complex, but we can also make it exactly what it is. And it's not dumbed down or simplified. It just, we treat it as exactly what it is and make it accessible, and then give people the tools they need and the supports they need to move forward. But what's really nice about MicroResearch is the participants themselves determine the research questions. So the questions are not based on ideas of what should be researched, but they're based on need, and they respond to community. So in practice, it's like it's a way to really look at what's going on, because a lot of times our research questions are somewhat determined by the funders. This instead, the research question is determined by the group, and therefore we see it makes huge impacts, as I'm going to show in some of our outcomes. So licensing, and of course, it was Robert and Noni, who were the Canadian co-directors of MicroResearch, who initiated this program initially 12 years ago. So objectives in this lecture are to define MicroResearch and describe its potential applications in both low-income and high-income countries, identify the challenges for developing research capacity in lower-income countries and community-focused research in high-income countries like Canada. And this is, again, one of the main challenges is things being dictated by funders. And describe the top-down knowledge translation gap in low and high-income countries and how community-focused research actually serves to address this. So to be able to see my slides, I need to figure out how to get rid of this bar, and I don't know how, so I can't read the top of my slide. So one micro project at a time since 2018.
Rosemary, I think you might be able to just drag that. We can't actually see the bar, but if you just drag it, I think you can probably move it around.
Okay, let me see. Oh, I can. Fabulous.
Okay, good.
Okay, awesome. So this is, one MicroResearch project at a time since 2018. And I'm going to talk about just how many publications have come out of this work and how many projects. So first off, MicroResearch is, we tie it to health. But as you see from this graph, there's nothing that isn't health. Health is social, physical, and psychological. And putting that together, everything we do is related to health and well-being. So I found there's no project that doesn't fall under MicroResearch, no matter what it's researching, because everything is tied to one variation or multiple variations of the interconnected definitions of health. So Millennial Development Goals and Progress. This is just to give you some context here. Since 1990, maternal and child mortality has decreased 50%, but the progress is uneven. So in lower income countries, 25% of global disease burden is there, but less than 1% of the healthcare professionals. So the capacity for local research in low income countries only represents 2% of global research funds. So they have 25% of the disease burden, less than 1% of the health professionals, and they only get 2% of global research funds. So we needed to find, and this is what Noni was really pushing for, we needed to find a way to make research accessible and responsive to the challenges going on in low-income countries that don't have the benefits of Tri-Council to the same extent we do. So if you look here at Sub-Saharan Africa, what you see is these very high rates of under 5-year mortality rates by region per live birth. So the rates are significantly high. If you look at the high income, and I'm pointing as though you guys can see me pointing, but if you look at where it says HIC, the high income countries, look at the difference between the high income and the low income countries. And then if you go to the world, you see they both skew it and pull the average together. And this is important because micro-research has actually impacted infant and maternal mortality rates. So we have, this is not an equality problem, but it is an equity problem. It's not having the access, right? And I like this graph. It shows us the difference again that we all know between equality and equity. Equality does not make everyone equal. It privileges some and reduces others. Equity provides the supports necessary based on where a person's coming from in order to find their ways forward. And not everything can be equitable and not everything can be equal. And sometimes being equal is still not equitable. So in low income countries, there's a research gap. And the focus of donors was on diagnostics and treatment of infectious disease. And we all know a lot about that, I'm sure. The clinical training of healthcare providers and improving the research infrastructure. So there was neglect here, and that was the neglect of local investigator-initiated research support. The challenge here was, of course, that the donors were determining what needed to be researched. So low-income country investigators were principal authors on less than 4% of the research that was coming out of low-income countries. So this represents a significant problem. So we find patients and collect data for donor country studies, right? They needed to be able to do their own research. And although we're talking right now about low-income countries, this is actually no different than what we see happening and why we have like our RIG policy, or research on impacting Indigenous people here in Newfoundland, right? There's many communities that literally don't have the infrastructure to do their own research. So it's persons coming in from the university, and we're part of the university. So in that sense, we have more capacity doing research in places rather than allowing them to do the research themselves. Challenge also happens when we come in with our own research questions, actually, instead of looking at what is relevant and necessary within those spaces. There's no opportunity to ask their own questions or to find solutions that fit. So in Africa, new knowledge often not implemented, proposed changes do not fit the local context or culture, and it's simply wrong word for the setting. Okay, so this is one of the things. There's a lack of champions, a lack of resources, etc. And this is a very inconvenient truth for donors and governments, because when you're working in an under-resourced area, and I'm sure everyone can understand this, immediate reactive responses they're privileged over preventative measures, because you have to respond to the acute crisis before you can turn back. So, and this idea, the new knowledge not being implemented that's created, is really important and key, because if knowledge doesn't fit the context, doesn't matter what we know, if it doesn't make sense within the space, it will not be implemented, because it becomes like Chesterton's fence. You create a solution to a problem, you expose 500 other problems that existed and create new problems on the side. So things have to be within the context in which they are studied. So there's also an alignment and a complexity problem. Problems compete for resources and attention, and they're often in silos and they stay in that silo. So oftentimes we can't see the consistency across. Like in studying infectious diseases, we could be studying COVID, we could be studying Ebola, we could be studying many things. And there's things you can do that are preventative across infectious diseases, but rather our focus gets on one and we stop looking at all the other challenges and how those findings can relate to other problems. So there's a need to influence decision makers. And it's hard when there's so many issues and voices. And it's also hard when the voices are not the majority and not that powerful. And often we're not hearing the voices of the community and the local healthcare providers when the donors are coming from the West or from the high income countries. There's also often no alignment between the stakeholders and the community. There's a lack of vision, which limits how we can best use talents. And there's restrictions on time and local resources. And we need both in order to reach a common goal. So one of the challenges of what MicroResearch was really responding to is if you have research need and you have people and they're disconnected from the ability to actually perform what they want to be performing and to make an impact in their own communities that is determined by what they need based on their local situation and context. And so I really like this table. So simple is to follow a recipe. You know, it can be tested, they're tested to assure that you can replicate them. You don't need particular expertise, although if you know how to cook, it increases success. And I can speak to that because I cannot bake for the life of me. Recipes reproduce standard products, and it's pretty certain that you'll get a similar outcome each time, results every time. A rocket to the moon, it's critical and necessary. Success with one rocket means you're more likely to succeed on the next. You need expertise in many specialized fields and coordinations. Rockets are similar in coordinated ways, and there's a high degree of certainty. But then you have a complex problem, the impossible problem, like raising a child. There's a formula, limited application. Raising one child does not mean success with the next. Expertise is helpful, but it's not sufficient. Relationships are key. And every child is unique, and there's an uncertainty of what the outcome will be. We just do our best and hope for it, right? So we have complex problems, complicated problems, and simple complex problems. And what we find with micro-research communities have complex problems. So we need to figure out what works within that space and recall relationships are key in this and to get some understanding of a way forward. I accidentally don't know what I did to move. Oh, there we go. So MicroResearch started in Africa in 2008. It's local, so training local universities, training sites, hospitals, etc. It's based on community. It's community-based and community-driven, and that's really, really important. And it looks for sustainable solutions for local health problems. What also really is important about MicroResearch, research doesn't have to be expensive. You know, in the university, we are increasingly asking for more and more money for grants as we are more successful. MicroResearch is done sometimes with, I reviewed a proposal this morning for $1,000 US to do an amazing study on impacts of COVID on stress and burnout among physicians in Uganda, right? Like it doesn't have to be expensive. A cross-sectional study doesn't have to cost thousands to run. So parallels and differences, we have microfinances and MicroResearch. So small loans to poor people with good ideas for personal economic growth. MicroResearch, small grants to people with good ideas for community-based health research. Microfinance is local setting, local capacity building, coaching and mentoring. We have local setting, local teaching, local capacity building and coaching, and distant coaching. Sometimes we do things over Zoom or Skype. We tend to use Zoom. And then we have local community grows as an outcome and loans are repaid. And here, investment is rapid through improved health outcomes, changes in practices and policies, and publications. People don't repay grants, they're still grants. So MicroResearch program process. So basically, we start with the MicroResearch workshop. So in this, we have these multidisciplinary teams. Often people don't even know each other coming in. And what may be really pertinent here is, for example, when we did it with clinicians, the commonality around the room was that everyone wanted to improve the research skills, get some experience and some coaching and publishing, and start moving in that direction. The team chooses its own question. Really, really important. I coach lots of these teams. I present and do things. I never inform the question. I do inform the articulation of the question in terms of research best practices. So things like make sure it's not double-barreled, etc. But I don't inform the question. We develop a research outline, and you do your first critical review at the presentation. So after this 2-week crash course on methods and working with your team, you do a presentation, and there's judges. And these judges determine if you go to the next step. So you write your proposal, applicants are asked to address any concerns of the judges, and you get approved for funding a bit from 1,500 to 2,000 Canadian. At the MI, we did 3,000 with the kids. We're doing less, like 500 per project. And we get our here it'd be HERB. We do the research and we translate the findings to community policy and practice. And we implement the knowledge translation. The other thing that's interesting is one of the things we do is we allow a second grant for knowledge translation, because one of the big things, it's really important to get the outcomes from your findings back to the people who will impact, because they do nothing if they just sit in a peer-reviewed publication on a shelf somewhere that people will skim. And there's so many journals now, it's near impossible to keep up with your field. Or at least I find it is. There's something coming out every day. I could read journal articles 24 hours a day and I still wouldn't be on top of it anymore. So if we look again, and this was a micro-research project. So under 5-year mortality rate by region, 1990 to 2015 per 1,000 live births, right? So if you look at this, look at the change in reduction in sub-Saharan Africa, this movement and this reduction. Okay. So if we look here, maternal mortality rate was 983 in 1990. It went down to 546 in 2015. This is a direct outcome of a micro-research project. What they found is local question. They wanted to see how their umbilical cord practices, which were cultural in Uganda, were the consistencies or inconsistencies with the World Health Organization's instructions for umbilical cord management. They found that the cultural practices were also actually impacting maternal mortality rates, and by aligning the practices with that they were doing with the World Health Organization's recommendations, they were able to create a reduction in maternal mortality rate and infant mortality rate. So just a small $1,500 research project that let everyone know that the cultural practices around the umbilical cords maybe weren't working out. So sustainable development goals, and we, many of us know this, the global goals, get rid of poverty, hunger, good health and well-being, quality education. These are hefty goals, but a micro-research project help impact these goals. So micro-research workshop participants between 2018 and 2021, we've had 1,143. We've had them from nurses, midwives, physicians, dentists, vets, physiotherapists, occupational therapists, nutritionists, dental technicians, lab technicians, accountants, librarians, development officers, information technologists, poultry farmers, engineers, lawyers. We've had police officers, we've had fish harvesters, we've had grad students, we've had clinicians, we've had psychologists, social workers, statisticians, allied health professionals, pharmacists. Basically, we've had a lot of people from very, very different walks of life. And now it's not difficult. These grade 6s, I'm teaching them again tomorrow morning. They're coming up with the research questions and learning methods. Like they're doing it and they're going to make an impact. And they're really excited to get published. So the workshops, we've done 46 workshops. There's 68 people a team, usually 3 to 4 teams per workshop. Proposals are submitted. We've had 141 proposals submitted for micro-research grants. We've funded 120 proposals, completed 42 as of December 2020, and 45 articles and book chapters have been published. And these include like in Lancet, in JAMA, like these are high impact publications that are coming out of this work. So here are some examples of outcomes. So this is one of the team's questions. Why do babies die in the first weeks of life in rural communities in Uganda? Another question was, what are the traditional practice around pregnancy and birth in southwestern Uganda? And this is the stuff that actually impacted the infant mortality rates. So thousands of babies can be saved in each year. So look at this, a new industry has developed, a Uganda company, now I can't pronounce this gel. And this gel is what is being used. It comes in a mama kit to apply to umbilical cord stop when their baby's born. So neonatal deaths in Uganda are now only 7%. Massive. And this is published, can't see the bottom of my screen, but there's a DUI that I can see. MicroResearch projects and outcome 2, a random control trial. This one was maternal neonatal mortality. I'm just going to shrink here. So if you look at this, will district health centers use preloaded cell phones for pre-referral phone calls for women in labor, a randomized pilot study at a regional referral hospital in southwestern Uganda? And what they found, they called. Loaded cell phone, people were more likely to call. Without a loaded phone, they were less likely to call. So now we have people reaching out when they need help when in labor. MicroResearch outcome 3, second project, multi-drug resistance tuberculosis. Study aim, determine risk factors in MDR-TB in Ethiopia. Funded, mentored by MicroResearch. And there's always a MicroResearch, like when we always have a coach who mentors you through, and then you've always got me, Noni, and Bob. 60% of the samples collected in 6 clients for presumptive data. Anyway, going on, I'm not medical. They found out the associated factors and they were able to make an impact. Published again in the Journal of Infectious Disease. Outcome 4, write non-MR grants. So one of the things, they've been able to take their skills from learning about grant writing to be able to write grants that actually get funded in these different organizations. So they were looking here at obstructed labor. UNICEF had a motorcycle ambulance grant opportunity. The MicroResearch grant wrote a grant, concerns about what to offer, but took the opportunity. And this is another example of a gap between donor funding and local needs. We had a follow-up workshop survey in 2016, and there were 641 MicroResearch participants. And that we reached out to. 143 didn't have an address, 211 had a bad address, 287 arrived, 73 didn't open, 218 open. We had responders from 98 participants. Right, so in our follow-up survey, and I'll show you what we found. Did MicroResearch impact your career? Yes, 88%. Are you still involved in research? Yes, 85%. And these are persons from all different areas, not just researchers or people who do research. Outcome 6, change the PG resident research training. So this was a family medicine residency training program in Kenya. It's a 4-year program. It required a thesis based on the British system. Noni can say this with confidence, but I'm not medical. So I say this quoting Noni, medical theses and graduate programs gather dust on shelves. The concern is teachers, little research experience, these topics are not practical, no KT, etc. So what they did is they ended up taking on a MicroResearch model for thesis development, and they applied it to family medicine, nutrition, and other areas in Kenya. And now they do this. And we're actually training 1,500 people in Kenya in MicroResearch to continue this program. So impact on the training, what methods are commonly used to procure illegal abortion, and how are they assessed by women in Kenya? Other questions, what are the doctor's knowledge and attitudes with regard to inpatient adults end-of-life care? Another question, how prepared do family members feel they are to provide end-of-life care for their advanced cancer patients? What are the opinions and understanding of vasectomy among married men in Kenya? What are the healthcare seeking behaviors of female sex workers in a rural area in Kenya? So these were all practical, relevant questions. All but one resident graduated. One actually left the program for clinical issues. All are now practicing in Africa, especially Kenya hospitals, several in teaching hospitals. All are continuing to do research because it became accessible. It didn't have to be overly complicated. And the program is now managed and taught dominantly by the faculty there, which is great because one of the key things about MicroResearch is not owning MicroResearch. It's about sharing MicroResearch, teaching people how to do their own research, and giving people the skills they need to impact knowledge. Another one, MicroResearch high output, look at low cost. Fiscally responsible. Many low-income research capacity building programs fold because they're too expensive or too few people are trained. The total cost for 27 workshops, that's 700 trainees, 60 approved projects funded, 21 were completed, all for less than $500,000. And it just needed volunteers and local support. And here's a quote: "We can do important research with no or only a little money. Lack of money should not stop us." And this is a micro-research participant in 2017. The goal of micro-research is self-funding. So Rotary links to micro-research to site. So we were funded, we got, Noni actually got this money from the Rotary Club in order to bring over and do stuff. Micro-research writing workshops, writing skills training limited. It's one lecture. There's a need for training, criteria to attend, must have data analyzed before coming to the workshop, and they develop a paper and we help them through. Trained 54 individuals in 4 workshops who are all working. And if you see this wee one standing, I'm pointing again, standing 3 people in with the blonde hair, the white hair, that's little Noni. So exporting micro-research from the South to North learning. So micro-research in Nova Scotia started in 2016. We've done, at the time that we did put these slides together, 9 workshops, 111 participants, and 6 projects underway. By discipline, we have a big mix and creating healthier communities. And I will say what's not in the slides is at the end of micro-research, when you spend 2 weeks working closely and being a coach for these people working together, there's a real connection and a real strong bond. And there's also research supports that you can kind of pass along among people and provide supports and help with other research projects. It's really interesting. Some of the people I've taught micro-research to are really great at stats, have helped me with my stats. It's phenomenal. So examples of micro-research questions in Nova Scotia. What are the costs associated with the resources utilized by chronically homeless, alcohol-addicted men? And what do these affected men say could improve their quality of life? What do young women who are groomed into prostitution identify as grooming techniques that were effective? What do First Nations members think of members of the community consume pop? And why do First Nations members of specific community consume pop and energy drinks? We've had 4 Mi'kmaq have taken 4 Mi'kmaq individuals have taken micro-research in 3 different workshops. This raised the question why micro-research is not being done on reserves. So we're starting micro-research, not necessarily on a reserve, but in Flat Bay in Newfoundland. That's on the west coast of Newfoundland in January. We already have it booked. We'll have 2 groups, 16 participants. Beyond, there's interest in Northern Saskatchewan, Nunavut, British Columbia, and we've also in Nova Scotia done it with some police services, and we're looking at doing it in the correctional space here in Newfoundland. Micro-research was done at the Fisheries and Marine Institute, and it's currently being done, as I said before, at St. Mary's Elementary with grade 6 students in Newfoundland. That's where I spend my day tomorrow. So micro-research in COVID. 3 micro-research Africa COVID-19 projects, all rapid review, funding and running. 1 is completed. I reviewed a proposal this morning. Impact of COVID on adolescents in Western Uganda. Migration back to villages, risky behaviors, violence in home, underage sex, sex for money, and rape. All things that have been studied within the COVID context. Virtual training, increased opportunities. So we have Nova Scotia, Newfoundland expanding to other regions. So could micro-research be applied to more than health problems in sub-Saharan Africa? What about housing, clean water, sanitation, roads, jobs, environmental issues? Aren't they all health? So in essence, it is. Outcome 12, beyond health, academics without borders, adapting micro-research principles to engineering, strengthening engineering, education, and research, where first micro-research program as oldest site and strongest site. So micro-research is about social accountability and equity in action. It's about communities being supported, whether in Africa or in Newfoundland, in recognizing problems, and then with help finding solutions that fit the context, culture, and resources. So here are some of the quotes. You don't have to be Superman to do research that is important to our communities. Micro-research was eye-opening, and I'm positive that will change my life. Micro-research ignited the dead researcher within me, and I am sure among all of us. This is the first time I could think of problems outside my discipline. It feels so great. And the last one talks about lifelong skills, but I can't read it because of the screen. So we have sponsors and supporters, participants and site leaders. So, it's really coming together and growing. And here's a YouTube, you can learn more. You can go to the website, microresearch.ca. And I'm going to stop there and take any questions.
Thank you so much, Dr. Ricciardelli. It seems like there's a lot of crossover between that work and the work that NL Support is doing. So I certainly have a lot of questions, but I'll I'll keep my mouth shut to let someone else go first if anyone has any questions. You can just choose to unmute yourself or type it in the chat. Yeah, well, maybe I'll get the ball rolling then. So at NL Support, we hope to build capacity for research in some of the same ways that you mentioned on a little bit of a bigger scale, I guess, funding wise. But often we have issues with accessing, in terms of community research, accessing the right person in the community, or if that person having the capacity to do a training program or to write a research grant. And I'm just wondering, like, thinking about the program starting in Flat Bay, how do you recruit for your workshops, or how do you identify folks who are going to go into that?
It was really simple. I just said, hey, want to do micro research? Here's a Lancet article about it. And then it's because you don't need to have a skill set.
Right.
You have to have an interest, and your interest can be just helping your community, and you have to be open to it. So like recruitment, basically anytime we've done it, like at the MI, we just sent an email out and people came forward. In Flat Bay, we sent an email out and people came forward. So it hasn't been complicated. I have been doing micro research in spaces where I am already connected. So it's not finding the person, but I often find if there's interest and you can see impacts and outcomes, people will gravitate towards it. And it's really just people who want the basic research skills. Like, I'd love to run one over in medicine. I think just like what we saw at WK at Dalhousie, there's probably lots of people who are interested, and research it can come across as kind of scary, and people can be intimidated by it. So it's kind of nice to do it as a team in an interdisciplinary space where there's shared skills. So I think it's quite beneficial in that. But I really find it hasn't been as hard to get participants as one would anticipate.
That's excellent. And then so after folks complete the workshop, it's that group that can then apply for the micro research grants.
Yep.
Okay.
They put in the proposal and put that forward.
Really interesting. It's just funny. There's just so many parallels. I mean, in our training needs assessment a couple of years ago, that was really the outcome, was that clinicians just wanted some more information about basic research methods. And so, I think that it just seems like a recipe for success. Kathleen asked in the chat, she says, apologies if this was answered before I joined, but I'm curious about how people come to micro research.
I feel like that's basically what you just answered. It was kind of the same question that Chelsea had. But yeah, I was just curious how, what draws people in. And so it sounds like really the kind of
yeah, and Catherine, Catherine Street, who is the director of our unit, wrote, I would be interested in exploring a local micro research program supported by NL Support. So definitely sounds like there's a lot of crossover between our goals.
Okay, so ignoring the barking dog, my apologies. We could easily run, like if there was interest in working with NL Support and running a micro research here in Newfoundland, we actually do, like at the MI, we now can run any micro research, like we can do it anytime. And Noni and I, like we work together to run them. So we're looking at running them across different public safety groups as well. So there's definitely ability to do that.
Catherine, you have your hand up?
Yeah, I didn't want to speak until I was given permission. Rose, we currently run some funding opportunities through Newfoundland Support, and we're probably not getting the uptake that we expected. And I just think that this new, more less intense way of doing it would attract more people and probably get more community-based ideas as well. So we'll have to take it offline, but I'd be fascinated in talking to you with Brendan and with Chelsea's our training lead as to how we might be able to implement this through the support unit.
Oh,
So
for sure.
it's been a great presentation. I've really enjoyed it.
Yeah,
Yeah,
no, we could definitely, and we will definitely take that offline. The thing about micro research is like, I'm not kidding. I'm teaching it to 11-year-olds right now. Like tomorrow, I'm doing quantitative and qualitative methods with 11-year-olds.
That's
And
fascinating.
and they all have questions. Like they're really interested in why people smoke, and they're really interested. They want to come up with a way of understanding how 11-year-olds understand mental health. Like they're incredible questions, and they're not questions I would ever think of. Like we had one who wanted to know why there isn't sanitizer at the top and bottom of elevators if everyone holds on to them and we have COVID.
That's a great question.
Yeah, I would never have thought of it.
It's a very sensible question, yeah. So yeah, let's talk about how we might be able to do that and launch some kind of program through the support unit. I've just got to convince Brendan now, but I think he'll be convinced. We'll show him your video.
Happy to help with that, Catherine, because as soon as you said about the workshops, Rosemary, I was like, oh, that's such a good idea. That's exactly what we're missing. So
Perfect.
And we have it like, and how micro research works is we've contributed and developed. So it's actually like we work now in partnership with Dalhousie, and the MI is part of MUN, so we can do all that.
That's great.
yeah,
Thank you.
I see in the chat here, Caitlin Greer asks, she says, beyond building capacity, what attracts people to participate in micro research? This was a fantastic presentation. I work with youth and this was so relevant.
So what I have gathered, so in the sessions I have done, so okay, the kids, they were told they were doing micro research as part of their curriculum in the school. So they don't count. They're really excited about it and loving their coaches. But I think it varies. Some people, it's really wanting to strengthen or feeling that research would, if it's part of their field, they want to strengthen those skills. And there's something comforting of having a coach or someone you can run things by and having some mentorship while doing the research. Oftentimes what I have found is people who want to make an impact in their community or have a pressing question they want answered. So they feel like they know what research needs to be done. There's a problem that they're constantly dealing with, and they want to know how to do that research because other people aren't doing it. So I think there's a big motivation, and I really find a lot of people are community driven, like wanting to. We had in Nova Scotia, there was a death by suicides at a particular high school. There was a variety of them in a short time period, and one of the teams wanted to find out what was going on in the school. Like how if it was coincidental, if it was like they just wanted answers and they didn't feel they were getting those answers. So a lot of people are driven by a quest for knowledge. And we also know that when it's data and methods and scientific, I was testifying the other day and I said that it's not my opinion, it's what the data says. I want to talk about what we think, I can take that offline. But as long as I'm being recorded in testimony, it's what the data says, right? Very, very different. And when you have that strength to draw on data, it really strengthens the arguments you make. Because often our opinions don't match the data, right?
I have more questions if no one else does too. So just thinking that coaching, back to that coaching model, when I think about it, it seems so resource heavy, but is it just you and Noni who are the coaches? Who do you get?
So the coaches, so with the schools right now, to give you guys an example, the class is divided into 4 groups. And I have 3 of my grad students, and 1 of my research assistants are the actual coaches. And I'm like the overall coach. I'm like I help them, navigate it through because they haven't done it before. So we generally find different coaches. My role, like Noni and I co-present the lectures tomorrow, and we vary on who presents. We try to mix up who's presenting and who's giving it based on different people's skill sets. Like the community engagement and knowledge translation, we try to have someone from the community be part of those lectures because they can talk about what community engagement, like in Flat Bay, we have someone from Flat Bay who's going to lecture on community engagement with us because they know how to engage their community and they know how to translate knowledge in a way that the community will hear it. Because our knowledge like a website's not going to do anything, right? So we need to make sure we're translating knowledge in a culturally relevant way.
Yeah, that's so important. And that was actually my second question was whether there were any knowledge translation outputs that stood out to you from any of the funded projects in terms of their variety rather than just journal articles. Something that maybe that reached the community, other than, although you did mention the gel, that was a good one. But
yeah, and there's lots of those kind of things. Like there's lots of little things that impact changes that have happened, and knowledge translation into practice is very, very common. And the knowledge translation, like it's made me more creative in how I translate knowledge in my research as well, because it's, the things don't, even if you're and one of the complications is when we, as an academic doing knowledge, sometimes one of the challenges is that the people you want to translate the knowledge to don't want the knowledge, because no one talks about that part of knowledge translation. One, knowledge translation gets pricey and can take up just as much time as the research. And two, knowledge translation is not always received well because people don't want to hear your research findings, right? So one of the things I find with the micro research is they find ways to present the knowledge in ways that are culturally sensitive and to the people who are relevant. And because they're so aware of the problem, there's and often it's people in the communities who can make impacts who end up participating or being the judges. So knowledge is flowing much more freely and in different capacities, with tremendous outcomes.
yeah, our Kathleen Mather, who's online here, is our former knowledge translation lead, and I'm sure she's clapping at you right now because that's really what we tried to promote, is that integrated knowledge translation and connecting with those folks early on in the research process.
Well, and knowledge translation doesn't stop when your study stops. I had a study, went on for 5 years with Flat Bay Band, and it's now been 10 years and I'm still translating knowledge. Like it doesn't stop. Like projects, they sometimes don't end.
Yeah, that's
even though
very
my
true.
role is done, I still have a role in, because they incorporated and took over what I did. And now they're running with it. And sometimes they need to check in, or we need to check something or update because a law changes or something happens. So it's like the project will never end.
Yeah,
But they have
really
to own it. It's not mine, it's theirs, and theirs to move forward.
Yeah. I see here too, Caitlin had another comment. They said, I will try to let the Alberta Sports Support Unit know about this too. We've been practicing something similar to this accidentally, but this seems like a more clear framework and a lot of experience doing it.
It's great. And I cannot say enough good things about Noni and Bob. Like they're phenomenal to work with, and it just makes such an impact. And the thing is, like, research is interesting, and oftentimes in the academy we forget that our research is really based on our data, and our data isn't ours. We don't own data. Participants own their data, and you don't own another person's story. So what I really like about micro research, it allows for that collaborative understanding, and it centers our people. So it's not about us growing. It's really like, they asked me at the school, what do I get out of doing micro research there? And I'm like, nothing for my career. Like, it's not about that. It's about teaching kids so that they go on and do research. Like if it was for a publication, there are way easier ways to get a publication, right? But you get the knowledge, get kids excited about research. And you should have seen them when they came over to the MI and used the library. You've never imagined that looking something up on a computer could be so interesting. And they're reading journal articles. It's crazy.
Wow. I'm sure 11-year-old Chelsea would also have loved to go to a university library. So I can empathize with that. But
and
yeah,
the
no,
MI has lots of toys, so we could take them on simulators and like,
Oh my
you know
goodness.
what I mean? It was really
Yeah.
fun.
That's a really good way to engage that group for sure.
Mhm. And make research fun. And that's the one thing, the group and the bonds that you create over those 2 weeks of workshopping together are just really strong and really helpful. And they make research interesting and exciting and create supports. And it's also about being a team. That's very important in micro research. It's not about one person doing all of it. It's about dividing your skills and everyone being your best you, doing what you do best, which is a really collaborative, interactive way to work.
Absolutely. And that's, again, that's what we try to foster with patient-oriented research at NL Support. So, and you're right, it is. There's a lot easier ways to do health research, but then it sits on a shelf. So wouldn't you rather take the time to build those relationships and to use everyone's expertise?
And my apologies, I do not know what happens to theses that are done in medicine. That's Noni's words. That was her slide.
I think, at least from my limited knowledge, it seems very accurate.
And it happens in my discipline too, so I didn't think it was too far off, but I didn't want to accidentally be offensive.
No, I don't think so. Does anyone have any other questions for Dr. Ricciardelli?
I would love to ask it more. This is so fascinating to me too, and it's so lovely to have heard the tail end of your presentation. So my apologies if I'm asking something that you captured at the beginning, but an area of work that we've been involved in was with the health accord, and so there was an element of the social determinants of health that I was really involved in that work. And so we think about, and I really love that when we said the sustainable development goals and how these other things fit in, and then you were like, it's all health. And I was just about to type that in the chat when you were presenting that. So that was fabulous to see. But in terms of things like, one of the areas that we were kind of looking at that hasn't been focused on too much being related to health is, climate change and the environment and things like that. Is that something that, there's been micro-research projects kind of related to?
There have been,
that
yeah.
aspect.
I don't know those offhand, but I do know, especially like water quality in Africa, I believe something's been done there, but I wouldn't want to quote anything because I don't know them all. I've only been doing it for a couple of years now. So I don't have as many experiences in research questions. Like I know we've looked at in Newfoundland, they're looking at mental health among fish harvesters and sort of the barriers and that kind of thing. But climate change, I'm pretty sure there's a variety of different projects that have looked at the different implications of climate change on different elements that then impact well-being.
Okay,
And everything fits, like literally they can research anything, which is kind of fun, right?
Yeah, I mean, it's so great because like you say, then, it's a community or an individual developed, concern, issue, whatever, that then they can go and explore, which is great.
And it creates a space for making change because the questions are relevant.
Absolutely. And especially if the question was derived from the community, you'd think that,
And it is more applied research in that sense, which I think is really important for research to have an impact. I'm sure there's like a theoretical contribution that someone in micro-research might one day want to make, but sometimes these more applied have a greater impact. And it does impact lives. I think it's fascinating what it's done for infant maternal mortality.
That's incredible.
That was a
Yeah.
team. It's like the umbilical cords. I think our cultural practices might be having an impact. Let's see.
Actually, I had a question about that. If you know the answer, I can just imagine how difficult that KT output would have been and that cultural change would have been from that project. If it was, if it was a cultural practice, and then they're saying, well, no, you have to align with the World Health Organization all of a sudden. So I'm just wondering, like,
but it's not just aligning. It was done in a culturally sensitive way. So Noni could speak better to this because I only know what I've heard her talk about and I've read the article. It wasn't change or eliminate the cultural practices.
Okay.
It's incorporate the protections to ensure that it's done safely.
Gotcha.
So it's still managing. I think what the point was with the gel is it prevented the infection that could have otherwise occurred, but I'm not 100% sure.
So that makes sense. That's excellent.
Yeah, like it wasn't no more cultural practice. It was how do we make cultural practices safer and align with the World Health Organization's recommendations, which is something you could only do in that context. Like the idea of imposing the Western way of dealing with umbilical cords wouldn't work. And that's how micro-research works differently, which is kind of neat, I think.
Definitely. Does anyone have any further questions?
Well, I'll say thank you for inviting me. It was really, really exciting to actually share it. I'm really excited about it. So it's nice to see some people interested in it. So thank you very much.
We are also super excited. So happy. I'm happy that we'll take this offline and be able to chat a bit more about it. Awesome. Carolyn Walsh says, fantastic program. Grateful to be able to hear about it today. Thanks so much.
Oh, thank you. And thank you to everyone. It was really nice. And it was a really great opportunity to share.
Thank you so much for being here and for telling us all about this. And if nobody has any other questions, if you do, please feel free to email them to me. I'm happy to pass them along. I'll put my email in the chat here. And also you can keep an eye on our upcoming training sessions at this address here. And I'll just say thank you again for coming, and I hope everyone has a wonderful afternoon.
Thank you. Thanks to everyone.
Thanks.
Take care.
Bye.
Bye.